Welcome, everybody, to our September edition of the Freedom of Information Oklahoma Lunch and Learn series. We're so excited that you're here today. I'm excited. I think our other two panelists are excited. Hopefully, those of you watching from home or office are also excited. Otherwise, what are you doing with your lunch break? My name is Andy Moore. I am the Executive Director of FOI Oklahoma. We're super excited that you're here again this month. Hopefully, some of you have been tuning in for our full series of events that we've been doing over the course of the year. We host these once a month with the specific aim of really educating the public about transparency laws in our state, both the Open Records Act, Open Meeting Act. I think a lot of folks recognize that they play an important role with the media and with journalists, which is why we have two journalists with us today. But through all of these, we also want to remind you that these laws are created not just for journalists, not just for government, but for everybody, right? As a regular person, they are just as accessible and relevant to you as they are to anybody else. So today our topic is about healthcare, and we picked this because what a year it's been, or two years now, year and a half, where healthcare has been on the forefront, I think, of everyone's minds almost every day, if not every day, and there have been even more important opportunities for us to highlight and recognize the intersection or the relationship between those transparency laws and how our government handles information when it comes to, I don't know, a global pandemic that's affecting tens of thousands of people every single day, and where that line is between transparency laws and privacy laws. And so we'll talk a little bit about where that, I don't know if I should call it an intersection or just a relationship. We'll discuss that some as we go along, but where the line is between those and how there's interplay between them. As I said, my name is Andy Moore. I'm the Executive Director of FOI Oklahoma. I will also say I come to this with some experience. I worked in healthcare administration for the past 10 years for a clinic in Oklahoma City that's a public health clinic serving people with HIV, and so dealt with HIPAA and healthcare privacy literally every day. I'm somewhat thankful to be out of that, and yet here we are today, right back in it. And so I'm joined today by two excellent journalists from here in Oklahoma. First is Paul Monies from Oklahoma Watch. Good morning, Paul. Paul with the nice bookcase behind him. And then also Kassie McClung from the Frontier in Tulsa. Hi, Kassie. All right. Well, so as I said, today we're going to be speaking primarily about the intersections and relationships between the Open Records Act, the Open Meeting Act, those healthcare privacy laws, most notably perhaps HIPAA, though that's not the only one out there that's relevant. So we'll start maybe with a broad question and then kind of narrow down as we go along. I also want to remember to tell you, attendees, participants, if you're watching at home live, then you can put questions in the chat or use the Q&A function of Zoom. I don't know why we have two, but that's those are the options there. Put them there. If there's a place where I can weave it into our conversation along the way, I will. Otherwise, we'll set aside some time at the end to address those then. Also, if you can't hang out for the full hour or you want to go back and re-watch this later on, later today, I will post this video to FOI Oklahoma's YouTube channel, which is a cacophony of wonderful information that you should definitely check out and subscribe to. And then, so if you're watching at home later, welcome. We're glad you're here, whatever time it is where you are. Okay, well, let's get started. Paul, I'll start with you because you're in the middle of my screen today. From your point of view, can you describe the relationship between transparency laws and those healthcare privacy laws? And I will recognize we're kind of asking you both questions from your perspective as journalists, but also I know that, you're you're still a person and you deal with this on a personal level. So yeah, how do you describe that relationship?
Yeah, I think, in normal non-pandemic times, transparency is always a balancing act. I mean, the whole goal of transparency just in general in government is to make sure you know what your government's up to, what people who work for the government are doing, how they're spending your money, and how to keep them accountable. And of course, that's the same all the way down when you're talking about healthcare. But of course, healthcare has a very personal component to it that, when we're all affected by something or we're all dealing with a health issue, we're not always wanting to share some of that information with people. And so I think that balancing test gets a little bit more extreme when it comes to healthcare privacy and what we can and should be knowing about our fellow people, especially in the middle of a pandemic. I mean, you think before the pandemic, they were collecting information at the health department on measles outbreaks that popped up occasionally, other kinds of stuff. They track on a regular basis HIV infections, which obviously are on the sexual transmission disease side, very personal information that they're tracking and having to look at. And I think most of us as journalists, we don't necessarily, unless we've got that person in front of us that we know we're working on a story with, we're not going to want anybody's personal information or health information unless they're willing to share it with us. I think from a broader perspective on the healthcare side, especially during the pandemic, we want to know how our neighborhood is faring in a pandemic, because COVID is an airborne disease. And I'm not going to catch something from someone in Miami or in Muskogee in Oklahoma City where I am. I'm going to catch it from somebody I'm going to the store with in my neighborhood, or out at a restaurant or something like that. So I think definitely it is kind of more of a balancing test when it's a public health part of transparency.
Yeah, that's a very good point. Yeah, we often look at the data that we see put out, by the government and by journalists every day as the new numbers come out. I'm someone who looks at zip code data, right, to know, am I more at risk at my local grocery store than I would be if I traveled somewhere across the state, which I also do, and it's nice to know exactly where you're going, what the risk might look like. Kassie, could you give us an example of, or do you have an example of a way that you have used the Open Records Act or relied on the Open Meeting Act to retrieve information for one of your stories about healthcare, COVID or otherwise?
Yeah, I'll try to stay on the theme of the pandemic since that's what we're talking about. And I know Paul, the example I'm about to give, he has a lot of experience with too. So early on in the pandemic, it was really difficult to get data from the state on where confirmed cases were. So I specifically was looking at, long-term care facilities, nursing homes, and I requested a breakdown of what facilities were seeing confirmed or suspected cases, and I got denied because they were citing HIPAA. The health department was, and I know Oklahoma Watch was initially denied those records as well because of HIPAA. So we wrote some stories about those records not being released. I think Oklahoma Watch did too, and that helped put on a little bit of pressure, I think. So those eventually got released. I did a few stories on where cases were happening in nursing homes. And I think later down the road, I did a story with health department inspection records on which long-term care facilities were being cited for violations because of the pandemic response. So there's a lot of opportunities for public records for pandemic stories.
Yeah, I suspect we'll be mining the data that's been collected in the last, well, however long this thing lasts, right, for decades to come. Kassie, did you ever get those records that you requested?
On the nursing homes, yeah. So I think it was, Paul might remember more than I can, but I think it was March or April when the health department finally released those nursing home records. And I think it goes back to something Paul said earlier, is people really did want to know, especially people who had loved ones in those nursing homes, they really did want to know where the outbreaks were happening and what kind of conditions or how safe their loved ones were when they're in those facilities.
Yeah, And I'll share a little bit of a personal detail here because I think it's salient to the conversation. Is that so? Both my mom and her mom, my grandmother, passed away from COVID directly or slightly indirectly. Grandma was elderly as it was, but um, before that, my grandma was in a facility, and we had a hard time getting information from the facility about exactly how many cases were there. Because as a care facility, they were somewhat nervous about HIPAA because they are a covered entity, right? And the state agencies, depending on how a particular state's laws are written, may or may not be, right? There's a case from 2006 in Ohio that was an open records case dealing with lead levels in water, where a journalism place, the Cincinnati Enquirer, I think, had requested some data about lead levels in water, and the state health department said we can't give that because it would be a HIPAA violation based on you could figure out if the levels are high here and there's kids there and they had rates. And the court ruled in the newspaper's favor that said you are not a covered entity. There is nothing in the state's laws that would allow the federal HIPAA law to supersede the state's open records law in this case, because they were not giving out individually identifiable information. And so, in Oklahoma, the best we could do is we know the zip code where grandma's facility was. If we can kind of gain or glean that community level, that could be helpful, but not as helpful as actually knowing okay, that's the zip code, but what about the building she lives in, right? How does that look?
Yeah, and I will give the health department some credit for releasing the facility level data for nursing homes. I mean, that they were among the first states to do that last year, as the pandemic unfolded, and it did take some kind of cajoling from journalists a little bit and from other folks, family members. Obviously, they were talking to the lawmakers too, needing that information and weren't really getting it because that was such a huge part of the first part of the pandemic was the infections in nursing homes, and that was a big priority for all the public health officials. So they did eventually give that, and they still actually now publish it every week in our weekly epidemiology report. There's a 45-page listing of all the infections and unfortunately deaths to date in each facility. And so we Whitney, Brian, and our reporting group did some stories on that at the time. And I think at the time too, we were hearing from local officials. We were hearing from mayors as well. They weren't releasing citywide even case numbers. They just had a whole case count. And so the battle was getting not only the zip code level at some point, which they denied initially, but it was getting just even city levels of infections, which, if you talk about a city like Stillwater or Norman, compared to one of the smaller places, the people in those places probably are, if they're a really small town, if it's 200 people, they may already know who might have COVID. You don't want to publicize that outside of that, maybe a little smaller place, but it's good to know, where those infections are happening and what you can do to respond to it. That's one of the ways to keep public health officials accountable, is if they just say we've got statewide cases of this number, we're doing all we can. How do you prove that, or how do you show that? And if they know there's a problem in one area and they're sending people out for testing or whatever else, then that's really a good way to know, what is going on in that single area. And I think we saw that with some of the pop-up testing centers that were early on in the pandemic last year. They were deployed to places where they saw high case counts because they were in local areas. And so I think getting that out of the health department during a pandemic was obviously an issue. The governor had an executive order that collected all manner of data at the beginning, PPE supplies, hospital capacity, very, very discrete numbers of hospital capacity on a daily basis. Obviously the case counts, and, we can probably talk a little bit later about how they accounted for death investigations. That's a difference that didn't quite match up for quite a while. But I mean, it's just one of those parts where you had them initially denying stuff because of what they called HIPAA, but there was also a state version of HIPAA that was actually more restrictive, that they would come back and say, well, yeah, HIPAA says this and has exemptions for de-identified data, but we're still acting under the state law, which is more restrictive, which I we talked to attorneys from the Reporters Committee for Freedom of the Press early on in the pandemic, and unfortunately, their reading was pretty much right. I mean, it was more restrictive. Now, it did take the Attorney General at the time to kind of come back and say, we can release zip code level stuff. We can release community level stuff at some point, but that took the Attorney General taking that action. And our argument was always, well, if you can release nursing home infections, you can surely release a zip code, since nursing home is in a zip code. So their logic for keeping that out never made a whole lot of sense to us on the outside. Now, their lawyers were probably telling them something else internally, but it was just one of the struggles that both Kassie and me and other reporters were trying to deal with early on. And just having that basic information about who around you might be infected.
Yeah, I think what we're talking about here is this push and pull between needs and wants and different forces there, right? So there is a need to inform the public and to use, that's why we have those transparency laws, right? To use them to help the public be informed so they can make better decisions and so we can hold the government accountable. There is also a legitimate argument to be made for keeping some information private to protect individuals. Paul, you and I both mentioned sexually transmitted diseases, which are tracked, and the state releases data on a county by county level, but they suppress data if it's below a certain threshold for certain counties, right? So if a county only has 3 individuals living with HIV, they just put a little asterisk. They don't report that, because if you're one of those 3 people and you happen to see the report, it feels very stigmatizing, right, for those kind of situations. So the state, the government's trying to make this decision of like how much is enough without being too much. And I think also it's worth noting, right, that just releasing information was not the only thing the health department was doing, right? They're trying to also plan a public health response to this pandemic. None of this, right, the coverage or the pandemic and the response are things that any of us have ever had any experience with on this level, right? Even the comparisons made to the 1918 flu are not totally the same, because they didn't have computers, they didn't collect the same kind of data. Information was not expected to be as readily accessible by everybody all the time, right? Paul, I've texted you 6 times in the last year asking you to share a spreadsheet with me because I didn't maintain my own private spreadsheet of all the state data because I've got other things to do as well. I was like, I think Paul might have this, but those kinds of tools are helpful for lots of reasons, right? So to go to that point, speaking of data, and you, Paul, I know you've collected a lot of data because I've seen your spreadsheet and because you put it out on Twitter and in your articles. Can you give us some examples of some of the data points that you've collected and how you obtain that data?
Yeah, so I mean, and Cassie's obviously tracking the same stuff too, but I mean, the executive order reports that were put out, while that executive order was still in effect for almost, more than a year. They stopped, I think, in May of this year. They went out every weekday. They had a lot of information on PPE supplies statewide, because that was obviously a focus at the beginning part of the pandemic. The hospital numbers. I mean, I input almost everything in that EO report every day, and it did take a long time. I was not. It was not a fun part of my job. I still track it on a weekly basis, a lot of stuff, but it's still not a great. I mean, I remember just spending an hour and a half inputting even the facility, like the lab reports from each individual lab, which I thought was needed to be tracking, and they do track it. But then, we didn't know exactly how testing was going or what the capacity was. And so at the beginning, I was tracking all that stuff. And then they had some demographic information, general demographic information on, who was getting infected by, race and gender and ethnicity. And so it did take a while, and it was very useful in formulating stories and responses to stories. But I think I did have to pull back a little bit. I mean, I had to stop inputting the lab stuff because that was got to be 50 or 60 or 80 labs a day reporting individual results. And I found out pretty quickly after that that I could just ask this health department to send me like the latest spreadsheet they have, because they're obviously sending out report that they keep in a spreadsheet themselves. So that was if I could need it later on, I could just request it at that time and look at the lab stuff. So um, these days they've gone to mostly weekly reporting, which is a pretty good, I think. Well, we thought was pretty good until this Delta variant came along, and then everyone was wanting more information, which makes sense. And so now just tracking, the cases, deaths, unfortunately, which are rising again, which I didn't like to see at all. And then the hospitalization number, which we can maybe get into later because there's so many murky parts to hospitalization data. Um, and then, I'm still tracking zip codes for vaccinations biweekly and weekly for active cases as well. So there's quite a bit there that I'm still tracking. And in fact, every morning I've got like a little checklist of 4 or 5 things I hit that's data related. And I'm not. That's just me internally needing to track and figure out stuff. I put some of it on Twitter, but it really helps me kind of organize a little bit on my thoughts on what I see happening. I mean, I am not an epidemiologist. I'm not a statistician. I'm a data journalist. I have a decent level of understanding of how stuff is collected and how data is collected, but it's not at a level where I'm going to do my own analysis and tell you how many people might be infected a month from now. I'm not that level of reporter, but it's helpful to track and kind of see where you think it might be going. So I'm pretty hesitant a lot of times to make any giant predictions at all, but it's definitely been helpful to have some of that data out there.
Yeah, sure. Well, and now it's probably a good time to talk about the hospital reporting, because that kind of, I think what we've seen, especially over the last few months, right, is this discrepancy in some cases between the data that is being provided by the government and the data that some of the facilities are being provided, and that has fluctuated a lot. Could you tell us a little bit about that?
Yeah, I'm happy to. The hospitals has been probably the most difficult thing to parse, because the way that it's kept by the health department, you've got to realize that nobody has like a single real-time look at every single hospital bed status in the state. And that's the first thing you've got to remember is like, there is nobody in the state that has that level of knowledge. We have reports that come maybe once a day. These reports are filed by hospitals with the federal Health and Human Services at maybe different times of the day. So they could be filling a report out in the morning when they've got pretty decent level of capacity. By midday, they're getting slammed and the shifts are changing and they're getting shortage of people that can come in. And they may have nothing by noon free. So you've kind of got to realize that there's no perfect way to describe hospital utilization. Now we hear from emergency room doctors and nurses and heads of department that they are getting slammed, and they're getting slammed right now with Delta, largely from folks who have been infected who are unvaccinated. And so their message right now is, look, we can take care of you, but it would really help us if more people got vaccinated and didn't have to come to the hospital, because we're still treating people that have, regular non-pandemic issues that they have to deal with. And so the best idea I try to look at kind of the statewide utilization numbers that the Health and Human Services puts out every day on their website. That's not going to tell you, is this one hospital full right now? Because people are coming in and out all the time in that hospital. And, I am incredibly sympathetic with the folks who are taking care of everyone in the hospital. But they're not reporting. They're reporting, but that's not their job. There's people at their hospital to report, and they may be a little bit disconnected from the people on the front lines in terms of how they get the data there or how much they look at the reports internally. And so I kind of take some of the stuff with a grain of salt of like, we're running out of something here right now, and everybody kind of panics, which I don't think is helpful for anybody. But I mean, I understand the frustration too. I mean, there's definitely some issues with capacity, and from what we're hearing from the hospitals on the staffing side, their last staffing survey they did last month statewide, they have about 200 fewer staff beds for acute care and critical care folks, mostly from staffing side issues. Some of the bigger hospital systems are using staffing services, but it's hard to compete when other hospitals in other states are dealing with similar kind of things, especially nearby states too. Kassie, I'm sure, has a ton of thoughts on that as well, but I just kind of I don't ignore it at all, but I don't tend to put too much in like one individual report at one time, because we've had these levels before, and it's not saying that was great at all. We have fewer people now. I think that people are getting burned out as well, so they're less willing to maybe pick up an extra shift if they're a nurse or a doctor on that front line.
Yeah, Kassie, do you have any thoughts you want to add to that?
I think Paul covered it really well, but like you said, hospital capacity is really complicated, and hospitals are dealing with bed management all of the time, but of course right now at a higher level because of the Delta variant. But we're getting different data points from, that are telling us different things. And I think hospital capacity is probably the number one question I get from readers is, what are hospitals looking at? So like Paul said, we're kind of piecing together that picture from different data sources. We're hearing from, state officials that, hey, there actually is enough bed capacity, maybe at that one point, but then we're hearing from the hospital leaders that they have 0 beds. So it is complicated. Data point constantly moving. So again, just taking what we see with a grain of salt and trying to give the public the best picture we can of what's going on.
Yeah. Some of my friends that work in the oil and gas industry, I've seen the virtual dashboards they have where they can monitor pump pressure and flow around the state or around the country in real time, right? Like it's gauges that are feeding out that data, which requires a ton of infrastructure. I mean, literal wires to the pumps, right? That produces information. And I think sometimes we assume that same kind of data dashboard exists right now in the pandemic, where we could, that someone is, that Commissioner Fry's got like a giant monitor in his office with all the hospitals in the state and how many beds they have and how many staff, and they just little needles moving. And that's not the way it works, because that's not the way healthcare works, not remotely. And we can monitor vitals of a patient that way. We cannot monitor vitals of a entire industry that way. And that would be nice, but that means that, to bring this back to, I think we'll say, transparency laws and how we get information from our government. We've talked about specifically 2 different paths, right? Like this passive path where they produce reports every day or every week, and that is a tremendous thing, right? Like that is good governance. That is a great way to build trust among your citizens, is to put out, good data on a regular basis and make it extremely easy for the people to find it, right? Like you can go to the health department website and it's the first thing. You can find it real easily, and you can stay up to date on that. Or like many people, you just check Twitter around 11:05 after all of the journalists have synthesized it and updated your graphs, maybe 11:15, right? And that is a tremendous free service. Thank you all for that. So that's one way, is that passive sharing of information, that passive transparency. The other thing is more of an active transparency, which means, and honestly, it's active on the, I guess this is from the public's perspective. It's passive that I can just receive it, and it would be active for me to go and request data from the government. It's probably reversed from the government side, right? It is active for them to put it out all the time, and more passive for them to wait for our requests. Kassie, for you, has there been any data that you wished you could get from the government that would require maybe more of an active approach on your end that makes it difficult to get, or just stuff they're not putting out at all?
Yeah, that's a good question. I think other than wishing, there was better hospitalization data we could get Snapchat shots from, I think in the past, I really struggled with getting raw data on coronavirus deaths. And Paul, you might have seen better data than I have, but I, so in the past, the Oklahoma State Department of Health, they, especially as the pandemic went on and unfortunately the death rate started to rise, from their standpoint, they ran a little bit behind on investigations on deaths. So the number they were putting out of how many people died wasn't matching up with the CDC's number. So we eventually found out that it's because they were behind on investigating deaths and confirming whether those were related to COVID or, from COVID. So I would like better data on death trends and, when those deaths were happening more in real time, just because I think that really speaks to the pandemic's trajectory.
Yeah, sure. Paul, what about you?
Yeah, I think probably the biggest need right now would be to be proactive would be schools and school districts tracking of cases. And I know that that does happen on a school level or district level. We see districts getting proactive with kind of updating the folks who are going back to school. And obviously everyone wants their kids back in school now, if they're able to. And, there's not a centralized location for that. And I'm not saying that would solve anybody's problem, but it would give us a better idea of what's going on globally from a statewide perspective and what might need to happen in terms of how, public health officials could respond or, education officials could respond. But I mean, we're kind of seeing piecemeal, reports from school districts on, a number of staff and students infected, quarantined, all that kind of stuff. And we have seen other states do dashboards or, data releases on a weekly basis. I'm not sure they all get to the school level, which is always what most people are worried about for their kids, especially. But that's one of the things that I think maybe could have been proactive given the emphasis on going back to school this school year. I mean, last year we were hopeful that schools would be back normal, and it didn't really get to that point for a lot of schools, unfortunately. And we're not even back to normal now. It's not even a word that we kind of think about right now, but more normalized or normal-ish anyway. But I think that's one of the things that maybe was a missed opportunity, especially as the summer kind of ramped up with Delta variant, that we could have said, well, sit down, figure out a way to do this. I mean, maybe I know that the last year the School Board Association was kind of helping out some school districts on just infection levels in their area, and putting out their kind of own map for their school districts and their areas there. But it would be helpful to know that at this point in the pandemic, especially as we're going back to school and Delta is still kind of raging out there.
Yeah. I think it's a good point. Also, that I think we went from normal to let's adjust to the new normal, and we realized that's not a thing actually. And so we're trying to understand what has been normalized, right? And I think a lot of people, a lot of parents like me, Paul, I know you got school age kids as well, right? You're trying to figure out, well, what are most people doing? Like, what's the trend? Because we all have a gut sensation, or we have anecdotal stories that we read on social media, or you hear from other parents, and it's nice to have some sound data upon which to make informed decisions, right? For the government and for the public. Kassie, a lot of your coverage that I've read has focused on some of those individual stories, right? So you've certainly done the global, here's the state level outlook, but I appreciate you've covered some of those individual people on the frontiers, doing a whole series about the faces of COVID. Often those stories include personal health information about that person or that person's family member who may have died. That information is explicitly not covered by open records because it's personal health information, and that means it is likely covered by HIPAA from all the healthcare entities. So you can't ask the government, you can't ask a doctor for information about that person, and that means you just have to get it from the person or from their families. Can you tell us a little bit about what your process is like and how you navigate those conversations?
Sure. So with our project on It's essentially a project about just telling, kind of trying to put a face to Oklahomans that were lost to the pandemic. So essentially, we've been writing a collection of obituaries. So we approach those a little bit differently than we would with really investigative pieces. So um, for those, I try to approach it, obviously with a lot of compassion and sensitivity. So I try to focus, I go in not just focusing on, hey, your loved one died from COVID-19, tell me about that. But I try to approach it as, hey, I'm so sorry this happened. Tell me about this person, your loved one. Tell me who they were, what their life was like, what they did, what they loved. And then I kind of go more into, tell me when your loved one got sick, what hospital did they go to, etc. So with those, because they're obituaries, we don't really go into records very often, but I will say for a more investigative story, I have gotten hospital records from people about their health care or their loved one's health care. And the way I approach those is, help me tell your story the best way I can and help me, you know, give as much transparency to it and as much credibility to your story as I possibly can with those hospital records.
Sure. I would imagine that also provides like more tangible context, right? For you can put the individual story in the context of the statewide response and the statewide pandemic. And it also helps give some flesh to the numbers that we might collect in spreadsheets to help inform. So in many ways, like it sounds like the reporting you do, the conversations you have is a two-way thing that helps kind of feed into that. And a vital piece of that is your ability as a journalist to receive that public data from the government so that you can kind of start building a framework in which to contextualize that person's experience. Is that a fair assessment?
Yeah, definitely. I think so. I think, the personal stories are really what connects to the audience and what really speaks to them and kind of puts everything in perspective. We can say, hey, 9,000 Oklahomans have died, but it just makes it so much more powerful when you can put a face that statistic and really, explain, or I guess try to capture what that loss of life really means.
Yeah. For really either one of you has the way in which you do your job, um, particularly in the way in which you relate to public records, how has that evolved over the course of the pandemic?
Um, I'll take that first because I just personally have always kind of had an affinity for data reporting and to go along with other investigative getting records and reason to Open Records Act or FOIA at the federal level. Just personally, I will say that I always knew this, but data is collected by humans, and humans make mistakes on data sometimes, and it's hard to track stuff sometimes. And there's a lot of reasons sometimes when you mentioned earlier about real time looking at drilling and rigs or whatever production's going on there. The decentralized nature of public health is a good thing generally, because you want the people most affected by something to be served by people who are close to them and make those decisions at that local level. But it's not helpful for collecting data on a larger scale that you need to kind of look at everything going on in the pandemic. And I think I will give the governor's folks credit for getting the executive order data compiled regularly. They were pretty smart about that. Of course, you've got to have actions to go along with that too sometimes. So, but there's a lot of data out there, and it's just, to me, I kind of, anytime I approach something now, it's just from even a little bit more skeptical as well, just knowing that we've had so many issues with some of the data requests and transparency. Kassie mentioned that the death numbers. I think generally, I was going along, like every other reporter, like everybody else, looking at the numbers, like, oh, our if you can call it a bright spot, we don't have that many deaths per capita. But then when you start adding in the stuff that they weren't tracking, we're pretty high, and we're actually in the top 10 per capita for deaths. So you kind of have that moment where like, it's that almost where the record scratches. You're like, wait a minute, this was not what I thought. So it's kind of been, it's been humbling for sure. And it's obviously been awful to kind of see. I hate to, you know, I don't ever think that I'm just collecting data and those things don't mean anything. They've got stories of people behind them at every single data point where it's a positive test or a hospitalization or a death. And, you know, the families are impacted, obviously. And it's terribly sad. So you kind of have to step back sometimes and think, look, this collecting data is fine, but it's not why we're doing this. You know, I can gnash my teeth about, oh, I didn't get this record or this data at this right time from the state agency, and I can be mad about that. But that's not why I'm doing this. I'm doing this to try and put it in context for people, to try to explain things. You know, we all have our little, you know, things, and I'm more on the side of radical transparency, but I do see limits on that too. And especially in healthcare reporting as well, you've got to kind of balance what people are looking for and what they expect. So I'm, you know, I think I've been humbled for sure a lot of this stuff too, just knowing that I'm not an expert by any stretch, but even the things I thought I was the expert in, sometimes I'm not true either.
Sure, yeah. Kassie, has it changed anything for you?
Yeah, no, I think Paul brought up some great points. This has been really humbling in a lot of ways. But I think, you know, we go back to talking about wanting transparency and it not being just data. I think early on the pandemic, things were just changing so quickly and so much information, policy was coming out, and the stakes felt really high. So I think that probably drove a lot of, especially data journalists, to really push for that data. Because, you know, I think keeping the public informed can, you know, hopefully inform their decisions and keep people healthier. But I think, you know, then versus now, I've kind of, you know, like Paul, I'm kind of a little bit more, I don't want to say passive about my pandemic coverage, but I'm kind of, or on the early days of the pandemic, I was like writing a story every day. Like, hey, here's what the government's doing. Here's what they should be doing. Here's what, you know, experts say they shouldn't be doing. But now it's kind of like I'm sitting back a little bit more and just monitoring the data every day, punching it in my spreadsheets, and just kind of looking at the overall trends.
Yeah, I wondered, and before I ask this question, I'll say we've got about 5 minutes left, maybe a little bit more than that. So if participants or audience, if you have any questions specific to healthcare and data and how Paul and Kassie have covered this, or honestly anything about open records, these are a couple of folks who have submitted a lot of open records requests and undoubtedly have some good pointers there. So I'm sure they'd be happy to field a question or two about that. While you're typing your questions, I will ask one more. And that is, we've talked a lot about data, which makes sense as data reporters, but there's a lot of other information that is covered under the Open Records Act, right? It's not just, we're not just asking for spreadsheets of numbers. There are correspondence, emails, policy documents, internal, you know, memos between agencies, between leaders that are also covered under the Open Records Act, so that we, the public, can have more insight into the decision-making process, into, you know, what data they had when, and into their goals, their objectives, and what they knew in the moment. And so often, I think we don't have an opportunity to unpack some of that stuff for months or years or decades until after major events, right? And Kassie, kind of, you said something in your last comment about your approach now is sitting back and less focused on the immediate day-to-day kind of pressing data, which I think makes sense, right? That's kind of my experience as a person. Is in the early days, I mean, every day at 11 o'clock, I was looking, and it was like, if I should know to panic or take a deep breath or, you know, whatever. And now it's like, okay, I'm just going to panic every day. Everything's terrible. So if I assume that, well, it allows me to think, what else is going on and why are these decisions being made? do you, what's your perspective on how our city, our state government has been about responding to that kind of stuff? And maybe a good way to think about it is not just in the immediate public health response, but in like the economic response with CARES Act dollars and all of that, where there are certainly lots of questions and maybe not as much information. They're not putting out, checkbook reports on that money, right?
Yeah, I will. Sorry, go ahead, Cassie.
Oh, no, go ahead.
I'll just say on the CARES Act money, I mean, definitely last year in the early days of the pandemic, you basically had open checkbooks for a lot of the state response. And we kind of saw a lot of that. The officials that there at the time kind of attribute to that fog of war. Nobody knew what was going on. But there was a lot of back and forth on whether or not hydroxychloroquine should be used or as a treatment. And the state obviously bought a cache of that fresh off the market, paid a lot of money. We didn't know where it went for a while. And so there was a lot of records to request on that I and I know the Frontier had worked on stories on that as well. And the state's public health lab moved to Stillwater with the conjunction of opening their pandemic center up there. That obviously was a big policy decision that had a lot of stuff along with that you could request records wise. In fact, I'm still kind of going through a couple of things. And actually that reminds me, there's maybe an outstanding records request that's still hanging around on that for that. But they, so I need to go back and update my own request there. But, there was that kind of stuff with, definitely the CARES Act money. And now the American Rescue Plan, I think, is another tranche of money that's coming into the state, way more than the CARES Act was too. So there's going to be a lot of records kind of still to be requested along those lines. I mean, we're less in the immediate panic mode, more in a general panic mode now. So I think there's still a lot that's not been uncovered just because our focuses have been elsewhere. I think back to May and June of this year, and we all thought, oh, summer's going to be back to normal. And June actually felt fairly normalish to me, just personally. And now July hit, August hit. And so there's a lot of stuff that's, we probably could have moved to as reporters or people could be requesting documents on that we've kind of like, oh no, we've put a stop to that and panicked a little bit and said, okay, we need to get back in. In fact, I didn't tweet out any daily numbers in June. I don't think. I was still keeping them, but I was just like, okay, we can maybe take a deep breath now. But there's still a lot to uncover. I think you're right as we go forward.
Yeah, I think, other than data points, things people can look at, we've tried to look back on is, emails between officials. And like Paul said, I think we also have some outstanding record requests for stuff like that. Just purchase orders. There's just a trove of records we can go back and look at to kind of learn more about, where that money went and kind of what was going on in officials' heads when they were responding to all of this.
Yeah. Well, as we wrap up here, I like to try to end on a note that is a tangible nugget of useful information for our audience. As I kind of said offhand, but I think it's true. You guys have both submitted a lot of records requests in your careers. Any hints or tips that you could share just about for anyone who maybe is submitting a records request to any government entity for the first time?
If you don't know what you're looking for, if you're looking for a specific record and you're not sure what to ask for, or how to word it, you can always, call the person who's in charge of records and ask, how do I ask for this? Also, I, keep a spreadsheet, keep track of, all the receipts, when you made the request, when you first heard back, how often you're checking back when they filled it, etc.
Cassie, I'm glad you said that. That's such a big thing. I think so many folks get nervous, right? They feel like submitting a records request means I'm going to be on someone's hit list, like they're going to view me as a a whistleblower, as a watchdog, as an anti-government person, when that is almost always not the case, right? People are interested in information. Also, it doesn't matter, right? This is the law. Like, this is designed for a reason that, and in my experience, most often, the folks that are handling these requests, like, know that their job is to help facilitate that, and they would love for you to submit a request that is very succinct and well worded and asks for what you're looking for, because it's easier on them, right? And so it is the old adage of an ounce of prevention is more than a pound of cure, right? That goes for when you request records. I think a little bit of effort up front to make sure that you've asking the right thing saves time and saves effort, and arguably, like, makes it easier and more amenable to the person that's going to be fulfilling it. So yeah, don't ever be hesitant to call and ask questions.
Right. And because it's everyone's information, and belongs to you. And like you said, the more specific you can get, the faster you'll get it, and the more the records person will like you. So
Right. Yeah, that's right.
And I would just add to know how they're collecting this information. Like you said, do a little bit of research. There's nothing like a targeted request in a time period. If you say the right thing, like, I need this form X from this time of the month to this time of the month, that has this information in it, or know how that agency kind of communicates internally. Anyone at the top of the agency is not going to get the raw data spreadsheet. Somebody is doing a report for them with that. Maybe all the stuff sent to the director on this in this time period, and so the specific part of it is key, I think. And I will say, and I don't think this is sour grapes, it's just a realization that our law is good and bad in terms of time limit, but I have asked for very simple, specific things, and they've still taken months. I'm sure Cassie's dealt with that too. And I understand, these agencies this is a public health agency, and we're in emergency for this. They've got a lot of stuff to do, but a vital part of their public function is responding to records requests. That's not an extra. That's not an extra thing you just do just because you are in government and you have to respond. You can't just say, oh, I'm not going to pay attention to this fire over here if I'm a firefighter, or, oh, there's a cat stuck in up a tree. Well, there's a lot of things that they do. And one of the things they do is to respond to open records requests and make sure that the meetings they have are open and follow the law. That's not an extra. You can't just throw it away because something else is going on.
Right. That's right. Well, and in fact, earlier I was reading my little open records, open meeting book from the Press Association, like one does on a Wednesday, and was reminded, right? This was a specific question, but someone had asked me, if I submit a request I'm looking for emails from these 3 days from, like, my city council member, but what if someone else has, requested all of their emails from the past year? Do I have to wait for them to fulfill that one before they get to mine? And I said, actually, no, that is in the law that agencies, entities are not allowed to say, end of the line, we have to go do all the other ones first. If the only delay allowed by law is however long it takes them to fulfill the request, and they should be communicating with you if it's going to be an unreasonable amount of time or a big delay. So if you are out there as a viewer of this video and you think you are holding off on submitting something because you'll be end of the line, not necessarily. You are your own line. Right. All right. Well, Paul and Kassie, thank you so much for being here today. This has been, I think, very interesting and I hope helpful to our viewers. I am going to put in the chat links to both of your Twitter accounts because we've referenced those as handy. Also, a link to FOI Oklahoma's Twitter in case you want to follow us over there, and then a link to our website, which I assume is how many of you got here in the first place. But in case you haven't taken a look, please check it out. I want to put on your radar a couple of events coming up later this fall from FOI Oklahoma. One is, we have more of these lunch and learns. I think next month is similar to this, but it's about our education records and FERPA, which is one of the more fun acronyms to say. And then we also have our annual awards event later this fall, likely in November. We've almost got the date nailed down, so stay tuned for that. But sign up for our newsletter on our website if you want to stay in the loop. It'll be a virtual event because, as we've discussed, the Delta variant is out there spreading like wildfire. So we're not going to take any chances, but it'll be a live stream, and we would love for you to tune in for that and get to see some of the champions of transparency in our state. I think we spend a lot of time complaining about those who do a bad job. We'll give them an award as well, but also it's nice to take a few minutes to celebrate those who have done a great job, either from the government side, from the media side, from the public side, and any other sides that there might be. Okay, well, this concludes this month's episode, and stay tuned for next month. Thanks a lot, everybody.